Hello from wherever you are. Really excited to be here. Really excited to be doing this panel. Welcome to Back to the Future, sister reflections on where we've been, where we're going, and where we're going. My name is Greg, and I am the Southern Organizing Manager here at Young Invincibles, where I primarily manage our young adult engagement, consumer education, grassroots organizing work, which includes organizing around the Affordable Care Act and Medicaid Expansion here in the beautiful state of Texas. And I am just really excited to be doing this. It's great to be here with all of you today for this discussion, which will cover a look back at where outreach and enrollment work has been with regards to the changes we've seen over the last decade, and then what opportunities lie ahead. We have some really seasoned navigators and certified application counselors with us to share their experiences and perspectives with you to help you prepare for what's to come this open enrollment. With us today, we have Ms. Tia from Pennsylvania, and she will introduce herself at the appropriate time. And then we have Ms. Jennifer from One World Community Health Center, and Tia is from Pennsylvania Association of Community Health Centers. So they're going to give themselves a full introduction when the time comes. But just a quick reminder before we get started that the chat is open, so feel free to introduce yourselves and add comments. But if you would like to ask a question to our panelists, please put that in the Q&A box, and we will get to those at the end of this conversation. Now let's get to know our panelists a little bit more. I'll start with Tia. Please introduce yourself and tell us a bit about your program and the communities with which you work.
Thank you so much, Greg. Good morning, good afternoon, depending where you are in the United States. But my name is Tia Whitaker. I'm the statewide director for outreach and enrollment at the Pennsylvania Association of Community Health Centers. We represent over 1 million patients in 54 rural and urban communities throughout Pennsylvania. And that's with about 2.9 million patient visits per year. 1 in 13 Pennsylvanians are health center patients, and about 86% of those patients struggle financially. We, of course, offer affordable, quality primary behavioral health care, dental, vision, pediatrics, pharmacy, and other supportive services like enrollment assistance, and we do that statewide. We have been involved in enrollment assistance with the Affordable Care Act, first the federally facilitated marketplace, and now state-based marketplace since 2013, and of course have been doing Medicaid and Medicare enrollment for a long time as well. So I'm excited to be here.
Wonderful. Thank you so much, Tia. And then we'll pass it to you, Jennifer.
Hello, good afternoon. My name is Jennifer Cifuentes. I am here representing the Midwest from Omaha, Nebraska. I work at One World Community Health Center. We are a community health center that is based, it was first founded with the purpose of helping lower income families, and we've been able to expand. We have over 700 employees at this time, and we kind of have different services all around to help our community, from social work, from what I do, which is the marketplace or Medicaid, as well as any other type of services they may need. We are growing, so I think right now we have about 5 different community clinics, and we're always looking to expand and as well share more resources if we're able to. I have been doing marketplace for about almost 4 years, as well as Medicaid. So I'm excited to be here. Thank you.
That's amazing. Thank you so much for introducing yourselves. Needless to say, we have the best of the best here with us. And so I want to jump right in, actually. So the pandemic has certainly affected every aspect of our lives, right? And I don't know about you all, but I am a little tired of the COVID-19 conversation, but it's one that's so relevant and so necessary, particularly in the realm of the work that we do around open enrollment. And so, or just navigators, whatever the case may be. And so how have the last 2.5 years of the pandemic impacted you all's individuals programs. And we can think about this from many ways. I mean, and we know we had to transition to virtual, which was difficult. Staffing needs, any challenges that came up with outreach. I mean, however you want to take that, feel free to, but just kind of give us a glimpse into how this pandemic has impacted your programs.
So I'll jump right in. Change is the only thing that's constant. And of course, we've had to shift strategies, but we never defer from the vision and mission of our community health centers and providing enrollment assistance. We shifted to telehealth, which was necessary to meet some of the needs of our patients. Many of our health center sites stayed open. They continued to do in-person appointments, in-person enrollment assistance, and did not close their doors. Of course, they had to follow the guidelines, PPE and testing and those types of things. But we just shifted. My community health centers have been doing for over 50 years.
So for us, not only was the pandemic in play at that time, but we also had Medicaid expansion here in the state of Nebraska. I believe it was fall of 2020. So we kind of had to adjust to not only, safety protocols for us and for the patients, but we also were trying to do our best to reach out to as much of a population that we could at the same time. And, there was a lot of imminent fear of, I don't want to go to the clinic, I don't want to do this, I don't want to do that. And so it was just kind of adapting to not only being able to reach out to those people that we knew would be eligible for this new program, but also keeping in mind all the safety protocols that we had to follow, especially implementing them since we are face-to-face as well. We also did add the remote assistance, which we previously had not done at all. So just navigating what was remote assistance for Marketplace, how to, explain things over the phone that may be a lot easier in person, but being able to simplify it in a way that, our consumers are able to kind of understand and feel comfortable understanding. And at the end of the day, just making sure they get the care they need during that, time of shift, like she said, change, just adjusting to everything.
Yeah, absolutely. I am really interested, I think, because I'm hearing you all about, having a shift to telework, however you want to describe it, and how that impacted your consumer base, right? How that impacted the people. And even though you stayed open, there were people who just didn't feel comfortable coming in. So I really want to know, more specifically, outside of your program, and I think you all kind of touched on this, how has the pandemic impacted your consumers, right? There are some parts in the country where access to technology isn't a thing, right? Or we have the digital age gap where there are folks who just are not comfortable using technology in any manner, right? And so really thinking about your consumers, particularly those who could not come into the clinics that were open. How did that impact our work with them? And I'll shoot that to Jennifer to get us started. Oh, okay. And we actually just got Dr. Michael Miner. And just quickly, do you want Reverend Doctor or is Doctor okay?
Whatever makes you happy.
Okay, oh, wonderful. Well, Dr. Miner is here with us, and we're certainly glad to have him join us. Dr. Miner, feel free to introduce yourself real quickly, and then we'll just jump right back into the conversation.
Good afternoon. My name is Michael Miner, and I'm the National Director of the National Baptist Convention USA Incorporated. That's our health initiative, and I work a lot on the national and state level with the ACA. Glad to be here.
Wonderful. Thank you. So, Dr. Miner, I just presented the postal question. How has the pandemic impacted your consumers? And so Jennifer is going to start us off, and then we'll move to Tia, and then we will pass it to you. So Jennifer.
Thank you. So when it comes to Nebraska, we do have a lot of rural counties. So definitely, for some people, it was a very good advantage of them being able to save the drive or not having to come in. But we also did see the side where we work a lot hands-on with the Latino community. So not only is there, maybe they're not knowledgeable about how to use internet. The literacy is not, as well known. Some people don't know how to use their email. They don't even know if they have an email. So some people we had to see multiple sessions a day because it can be very overwhelming. So just being able to give them the attention, the time that they need, and just try to simplify it as best as we can. Explain it in simplified language so that they are able to kind of capture what you're trying to explain to them, but also walk them through, educate them as you're doing that. So it was definitely challenging. I think another thing was also sometimes playing phone tag with people. So we would schedule people and they wouldn't call, or we would call and they wouldn't answer. Calls wouldn't fall through. And so when it's in person, it's a little bit more credibility, and you're like, okay, you need to come into your appointment. And being virtual or remote is sometimes more difficult, where you're calling them and they don't answer, and you set up another one, you call them and they don't answer. So we did see a little bit of a fallback on consumers getting the help, because it was a little bit difficult to just kind of set a time where we were able to communicate with them. Also, because our hours are 8 to 5, and sometimes that doesn't work for a traditional household where they work 8 to 5. And so trying to see if we were able to call them on the weekends or in the afternoons, and making that time or that effort to kind of reach out to them.
Yeah, thank you. Tia.
Well, here in Pennsylvania, we actually saw a little bit of the opposite. The no-show appointments decreased significantly with the option of telehealth and virtual assistance. We also noticed that some of our consumers were adamant about getting health insurance because of the threat of COVID, and understanding that bankruptcy is real when it comes to medical debt. So yeah, we had a lot of folks who were ready, willing, and able to access the virtual services. We did spend additional time with consumers who needed assistance with the tech. Some of our health centers and enrollment assisters had pre-appointments where they would work through the technology issues and really pre-screen to say, okay, we're going to be using the Zoom app. Are you familiar with Zoom? Do you have it? Do you like it? Do you necessarily need it? I can walk you through doing the same thing that I'm doing on the website, or do you want to spend the time to really, hit the Zoom link and go through all of that? So it really required conversation, extra conversation, and an additional level of comfortability with the consumers. Also, the ability for folks to use their cell phones to upload needed documents and take pictures. That was wonderful. That took some time too, but it was crucial, and it really impacted the amount of time and the number of people who enrolled.
Wow. Michael.
All right. Well, for us, it was kind of somewhere in the middle. We, as in the state of Mississippi, where we actually a navigator team, we used whatever the consumer had. Some of them it was Zoom, some of them it was Duo, some of them was FaceTime, whatever it was, so we connect with them. And we centralized our efforts. We had a point person. If some of our team members were a little shaky with the technology, we had a point person who would actually work with the consumer in getting them to go through the virtual process. And I would say we were a lot like Tia, in that people who went through this process, they wanted to get coverage. They wanted to get it done. And of course, one of the big challenges in Mississippi is that it does not have a lot of high-speed internet service. So in certain times, we had to maybe have them go to a place where they could access a hotspot or Wi-Fi, so they could get on board. But as we started doing more and more during the pandemic, more and more of our team members were more comfortable, and so really became a second nature. And really now, even though we're going from a pandemic to an endemic, we still do some of that because people are comfortable in getting that done. Saves them time, saves them gas.
Yeah, I really love the angle that y'all took. That I think Tia started us off with the only thing that's constant is change, right? And so it's about adapting to those changes. And it sounds like it's actually been beneficial in a way. I mean, there's certainly, of course, some challenges, but it's been beneficial to our ability to connect with people and to get them processed even quicker to get the help that they need. And so I absolutely love that. And so I think I want to ask, so we're thinking about the future, right? We talked about where we were previously and kind of the shift. If you're thinking about the future, how will this enrollment be different, right? How will this OE be different? Will we continue to use virtual options? Are we going to increase our in-person work? I mean, really take that however you wish. And I think I'll start with Michael. The work that you do with NBC, how will your work and connecting with consumers specifically be different during OE this year?
Well, I think the biggest difference for everyone is that we'll have this continuum of ways to connect with you. Prior to COVID, hey, we got set up an in-person, appointment. Mm-hmm. So now we can meet you where you are. So as part of our training, we just had our training session last week with our navigators in Mississippi. And the deal was a part of the session was working with our team on doing virtual appointments. So that's going to be the first big difference. I think the next big difference for us is that it's much more affordable. Used to be we had to do a lot more work on, the premium may be a little bit more than you want, but you need to do this because it's bad if you don't have, so on and so forth. But now with the patches of the Inflation Reduction Act, we actually can go in and have, very inexpensive premiums. So one of the things that we're going to be doing different this time around, maybe you applied before and you felt like it was not affordable. This time it will be. So the virtual aspect and now being able to market it, yes, now you will find it affordable.
Love that. Jennifer?
So for us as well, I think we have permanently implemented the remote assistance and making that flexibility or that option available for all of our consumers. We actually just hired 2 new navigators, and one of their main focus is doing the remote. So just having more people's hands-on available for them this upcoming open enrollment, as well as any changes in policies that are coming up. Hopefully, we're always looking forward to getting more people over on Medicaid since we do have that expansion. Consumers that maybe didn't come in since prior to the pandemic are going to be coming in now, or, get in touch with us now and being able to inform them about all these changes that are coming up.
Yeah, absolutely. Tia.
And I absolutely agree. We'll be doing more in-person assistance and marketing and brand awareness. This will be our third enrollment cycle as a state-based marketplace. So there are still folks who have no idea that we are not using healthcare.gov anymore. We're using penny.com, which is the Pennsylvania Health Insurance Exchange. So really getting back out there as the world starts to open back up. We'll continue to do enrollment in-person assistance. Of course, we're not going back either.
Yeah.
We're moving into the Jetson age. We're going to stay there. So virtual assistance, telehealth, teleappointments, telephonic appointments, that will always be around.
Wow, love that. And so, and T, I'm going to throw this one right back at you, actually. We know that the current administration has been, generous in its funding. There's been additional funding provided to do the work that you all do. And so just kind of take us through how this additional funding provided by the administration has helped your program.
So because we're a state-based marketplace, we are funded through state funds. So the administration adding dollars did not make its way to Pennsylvania.
You are so right. I knew that too.
We just 3 years ago, but our Pennsylvania Health Insurance Exchange Authority is working to ensure that the partners who are enrollment assisters and navigators have the funds available to go out and to reach those most vulnerable populations. This is a brand new program. It really started up at the beginning of the pandemic. And like I said earlier, brand awareness is not as high as we would like it to be. So we are encouraging the state-based exchange to funnel funds into the program for the people who are on the ground touching the consumers who need coverage.
Mhm, absolutely. It's so funny because I literally have on my notes at this question that Pennsylvania is state funded. And I go, Tia, answer the question. It's hilarious. Okay, we're live. That's what happens, right? We're live. So Mississippi, Michael, what is the administration funding been like for you all there?
It's been tremendous because at 1 year during the Trump administration, we only had $57,000 to cover the whole state. So this year we got almost $2 million. So what it has allowed us to do is to hire more navigators. And the biggest thing for us is that we're able to have more coverage throughout the year. Previously, we had a strong, presence doing open enrollment a little bit after, a little bit before. But now we're able to work with consumers throughout the year because we have people that for whatever reason they lose their jobs or they have questions about their coverage. And especially when it comes to coverage to care, we've been able to really work with them, help them to identify providers, to be able to kind of work with them on troubleshoot some of the issues they may have had going through that process. Now, since Mississippi is the only state that still has a paper-based Medicaid and CHIP application process, it has allowed us more. Yes, I know. It's allowed us more an opportunity to work with these consumers to get them done. And in Mississippi, because for a lot of people, since Mississippi did not expand Medicaid, it's also given us more time to really drill down and work with those people that we have to refer to federally qualified community health centers. And the final thing this year with additional funds, because of the wind down eventually going to happen, we're working on an app that will allow us to connect with these Medicaid and CHIP recipients, because sometimes, real quick, in the state of Mississippi, the beneficiaries received a letter saying they were dropped from the postpartum, the new birth individuals. They were dropped from the program. We know that wasn't true because it's continued. Then a second letter came out and said, well, no, you're not dropped. You now have coverage through the Biden administration expansion. But the issue was they got the first letter, they didn't get the second letter in many cases. So we try to use the app to be able to be a backstop to make sure the consumers know what's what. And this is all because of the additional funding.
Wow, I love that. So I kind of want to shift a little bit out of the pandemic. And thank you all for taking us through that. That was really, really helpful. And just helping us understand how the pandemic has caused you all to shift, how that shift has showed up in the work. It's really, really important. But I think I want to shift more and talk a little bit about the policy side of the work that y'all do. And so we know that there has been this landmark passing of the Inflation Reduction Act, and then you had the American Rescue Plan, which was a huge piece of legislation in and of itself. And so how have those expanded subsidies, the end of the subsidy cliff under the American Rescue Plan and Inflation Act, how have those things impacted your consumers? And then how do you talk about the family glitch, which we know is something to address? So I want to start with you, Jennifer, and take whichever question you wish to first.
Thank you. So I guess I'll jump off of the policy, and the policies have been implemented. I think it was definitely a positive thing that we saw, or at least we saw a big increment of patients coming in once the advertisement came out that it was going to be expanded until January 15th. I think that was a big thing for us here in Nebraska. We had a lot of more people show up, a lot of more people looking for health coverage and needing that assistance. And so we were able to kind of help people who also previously had tried the marketplace and never had any success. We would encourage them, just try it, just, see what you can get. And with a lot of the federal poverty guidelines policies changing, they were able to get really good plans. And there's nothing better than to see our consumers, fully covered or get a really good plan and being able to feel comfortable going to get those medical needs. So I think that was a great thing. We do see, unfortunately, the family glitch a lot, especially with Nebraska expanding Medicaid. We thought a lot of that would kind of decrease, but we do have a lot of family members or families, because we do help a lot of families here who kind of fall within that realm. And here at our clinic specifically, we have other options for them. So we work with a lot of resources and referrals to other hospitals. So we've been able to kind of assist with getting financial assistance, even after they've been kind of trying with the marketplace or Medicaid, and they haven't been successful at all.
Mhm. Thank you for that. Tia.
So as a state-based marketplace, we are fortunate to be able to make some changes and really take a look at what we can do. And beginning in October, our state-based marketplace will be looking at the employer-sponsored insurance affordability question on our application and be able to make some changes to the way the income is calculated. Because when you're looking at income for the entire year, sometimes it shifts throughout the year. So we have folks who are teeter-tottering on the line, whether they'll qualify for the state-based marketplace or slide back to Medicaid. So with the addition of those questions, we'll be able to sort of catch some people who are in that gap and churning back and forth with their income. And that really can help and will help with those who might fall in the family glitch.
Absolutely. Michael.
All right, again, as stated previously, is that we're just marketing to the people, say, look, it may not have been as affordable as you thought it was before, but now it is, to come on and apply. And we're actually seeing people now upgrading plans. Maybe before they were only able to afford a bronze plan, but now they can go up to a silver plan. That's been one of the nice outcomes we've seen with the increased subsidies. And when it comes to the family glitch, that has been a problem in the past, and people just had a big issue not being able to get covered. So what we're saying now is that when our training we had with our team, we said, just don't worry about all the mechanics of the family glitch, just have them apply. The worst thing that can happen is that we refer them to a federally qualified community health center. But the best thing is that we can get them covered. That's our focus when we work with people. That way, if we go through the process and it's not affordable for them, we have not dashed their hopes. We told them on the front end that we'll connect you with some way of having access to a health professional. That's how we address it. And we're really not going to do a whole lot of marketing about the family glitch, because about 99% of the folks who apply, who are on the ACA in Mississippi, are going to qualify for a subsidy anyhow. So our whole process is just basically, let's just apply and see what happens.
Yeah, absolutely. So I want to keep us moving and talk about Medicaid expansion. We know here in the state of Texas, for example, Medicaid has not expanded, and this current legislature is coming up, and we are certainly will be revisiting that. But the reality is there's not a whole lot of light at the end of that tunnel here in Texas, to be sure. And it has severely impacted our communities' ability to access healthcare, right? And so I think the answers will vary here, and I'm really interested to see how they will. But how has Medicaid expansion or the like thereof impacted the communities you serve, and how is your program preparing for Medicaid unwinding? So I want to start with you, Michael, and then we'll shift to Tia and then Jennifer.
All right. Well, Mississippi, did not expand Medicaid expansion. As a matter of fact, a lot of the hospital association, even the strong farm advocacy group in the Mississippi Delta, they're all saying, hey, we need to do this because it's causing rural hospitals to shut down. But right now we have a couple people, I won't get involved in the politics or anything of it, that just feel like it is just another form of welfare, and this shouldn't be expanded. So we don't expect it to be expanded next year. And as long as the current political structure stays the way it is, we don't expect it to be expanded in the future either. So with that said, we do everything we can to work with Medicaid and CHIP to make sure the children are covered. But sadly, in many instances, the parents will end up being referred to a federally qualified community health center. But Greg, I do want to say one of the upsides that we've had with this is that we continue to work with these those people that we refer to federally qualified community health centers, and sometimes they get a job, things change, and we can with the better subsidies, we can get them on the ACA and get a better coverage. But right now in Mississippi, it's just not going to change, and we just doing everything we can to find a way to get them connected through our federally qualified community health centers.
Absolutely, thank you. Tia.
So we expanded Medicaid in 2015 and have a little over 1 million consumers who have enrolled in the adult basic program thus far, and have seen great strides with our Department of Human Services, working with consumers and working with other state agencies and the state community and sure that those who qualify for Medicaid know that it's available. Just
we
like
have a little problem with your volume. Is it just me? So going in and out a bit.
Can you hear me?
Okay, yes.
Okay. So let me jump back. So we expanded Medicaid. We expanded Medicaid in 2015 and have a little over 1 million consumers who enrolled in the adult basic program. So our Department of Human Services has joined other state agencies, worked with community health centers, partners, and other organizations to make sure that those who qualify for Medicaid know that it's there, and know that, like Dr. Miner was saying, in the past, you may not have qualified, but you do now. And then as far as the unwinding, we're just waiting with bated breath. We have been having lots and lots of discussions with our Medicaid agency, our CHIP agency, and with our state-based marketplace. They all work in tandem, which is wonderful and can't be said for many other states where all of the agencies work together. They have a plan, a communication strategy, and have been all along for the past several months saying to folks, hey, you need to make sure we have your right telephone number. We need to make sure your address is up to date. So all of that will work in tandem when we actually get the 60-day notice, and boots on the ground, folks on the telephone, getting the word out to show folks and tell folks exactly what will be going on when the unwinding starts to take place. So I think we're prepared.
Yeah, I love that. Jennifer.
So as I had mentioned before, Nebraska expanded Medicaid basically mid-pandemic. It started August 2020, and everybody kind of rolled into their benefits October. So we kind of worked with just having as much staff as we could to be ready to assist. A lot of promotion just virtually, online, everywhere, because we've had a lot of people who would come in and be like, well, I've never qualified, what's different now? And it's just, they didn't know, they're not aware. So just trying to get as many people as we could, spreading the word. A lot of the stuff is word of mouth. So, having someone come in, hey, tell your family members if they're, letting them know these are the guidelines, these are the things that you need in order to qualify, so that we're able to kind of get that conversation started. Our Medicaid expansion also kind of shifted from one year to the other. So we kind of started with the tier system, and then they're like, no, let's not do that. Let's just give it to everybody. And so just trying to process through that and educating, what kind of benefits you have, what you can use it for, what really is Medicaid, because some people just didn't really know. But it's been amazing. We've been able to get so many more people enrolled in Medicaid, and it's been a great experience, and I'm happy that we were able to do so, even though it took a while, but we've been able to kind of utilize that and get more people enrolled in that. So yeah,
no, absolutely. I get such joy listening to how the expansion of Medicaid has impacted y'all's communities. That'll be our testimony one day. Reverend Minor, that'll be our testimony one day. We just gotta keep pushing. That's absolutely incredible, and I'm really excited to just see, particularly in Nebraska, how that just unfolds and blossoms. It's gonna be amazing. And so, 10 years. It's been 10 years, which is crazy, right? Cannot believe it's been that long, and it's just incredible to see what has happened. And so, thinking about open enrollment 10, right? 10 years out, what is your outlook for this season, this open enrollment season? Is it positive? Is it negative? How are you preparing? Are you expecting any challenges? And what, advice to navigators, particularly new navigators that are starting with OE10? And so feel free to take all of those or some of those, or whichever angle you wish to, as we talk about OE10. And I'll start with Jennifer to open us up with this question.
I'm excited to say the least. I think it's always amazing to see new companies kind of come aboard to be able to offer new plans, new information, new coverage. And so that's always exciting to kind of compare previous years with these new companies that are coming on and offering benefits. I think it gives the patients or the consumers way more options to kind of tailor it to their needs and tailor it to the benefits that they are looking for. Ask questions. That would be my biggest advice. Don't be afraid to ask questions. I think that's one of the greatest things that we do here. We're able to kind of talk with each other, all the CACs and the navigators, and kind of say, hey, this is the situation I'm going through. What do you suggest? Kind of compare. Just communicate and ask questions, I think is one of the greatest tips I would give for when it comes to open enrollment.
Yeah, thank you for that. Tia.
So I'm hopeful. I'm always hopeful. This third year with our state-based exchange brings the benefit of experience. It was very, 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 very new the first year. This current year, last year, we learned some lessons, and I really think moving forward, we have the potential to do greater things. We just received rate information about the insurance plans that will be providing coverage on the marketplace. And there's about an average 5.5% increase in rates, but the IRA is going to help with those increases. We have all of our counties are covered with health insurers. There are 8 plans that will be operating in the state. So there's lots of information sharing, lots of plans. And I'm really hopeful because this is a good state-based marketplace. And getting the word out there about it really would be helpful to the folks who have no idea what health insurance is or why you need it. They don't have an idea of what a state-based marketplace is, as opposed to, well, we were on healthcare.gov and I'm still saying commercials for healthcare.gov in Pennsylvania. So it also spurs the conversation, and anytime we can get conversation, there are those of us who are trained and certified to provide clarity, and then that word of mouth goes to other folks. We try to ensure that our enrollment assisters are educated or not only on the marketplace, but on the nuances of Medicaid and CHIP and our community health centers with the sliding fee. So I'm very hopeful for the upcoming enrollment period.
Yeah, I love that. Michael?
I have never been as excited about open enrollment period as I am about this one. I am super excited. Why am I super excited? All right, I'm picking what Tia and Jennifer were talking about. We got the subsidies out there. It's going to make it more affordable than it's ever been. I have additional resources, so I have to worry about not having enough people to cover the different areas. And we have 3 full-time insurers, over the whole state, and 1 partial coverage, because there was a time we only had 1. So there's more choice than ever before. And now with people learning more, are starting to be more accepted, regardless of their political stripe. They're starting to realize that the Affordable Care Act is not welfare. It is genuine, good health coverage. The only thing the government does is facilitate the connection so that you can get enrolled. And the other thing that we do a lot in the faith community, obviously, and we're seeing much more support, and not because the faith community wasn't supporting it, but as it's kind of drilling down and understanding what it is and how important it is, we're getting a lot more support in the faith-based community across the country with the National Baptist, and especially in the state of Mississippi. And they're really working to push. One thing we tell them all the time is that wouldn't it be better for your congregants to be covered? Because if they're not covered, maybe some of the money they want to spend in the building fund drive is going to go toward medication. So it's in your best interest to want to see your congregation be a lot healthier. And we got some great people that fall in the Young Invincibles age bracket that are helping us with social media. And we'll be able to better capture that, getting it done all across those ways and seeing people tag and share. And those influencers, there's always some social media influencers, even if they're not getting the big bucks, they're going to tag people and say, check this out. So we've been thankful for it, but we got to the point where we got a lot more savvy with our social media. So I'm excited for OE10.
Yeah, I love it. I love it. I can feel the excitement come from Mississippi, Pennsylvania, Oklahoma, or Nebraska, excuse me. I feel it. And everybody in the chat, thank you for being so engaging. We love to see these comments and all that's going on. And I hope this has been helpful. So we have about 20 or so minutes. And so I just want to ask 2 more questions within that time. I saw Mina. Oh, okay. We have about 20 or so more minutes. And so as we think about folks get connected to the ACA, what is it like, or how do you connect those people then to those services that are provided through the ACA, which we know is a whole nother beast, not only to get them connected to the ACA, but to get connected to the services and to assist them in getting connected to services. So what is that process like? And I think I want to shoot this one to Tia. What does that look like, connecting people to services after they have signed up and been benefited by ACA?
So the first thing is to have folks, enrollment assisters, eligibility counselors, knowledgeable in all aspects of enrollment. If you're not specifically doing Medicare enrollment, know one point of contact that folks can go to ask those questions. So making sure those of us who are certified understand the entire process is extremely important. Also, really just being sure that when we talk to folks, we get the background, we get an understanding of what they need. Not giving them information that they don't, but listening to them and finding out exactly where they are and connecting them for us specifically to a community health center. So we're not only enrolling folks who are patients of community health centers, we're enrolling folks in different walks of life, different socioeconomic backgrounds, and saying, yeah, it's great now. I'm able to get your health coverage. Now you need to see a PCP. You need to get glasses. You need to get your A1C. You need to get pharmacy services. So coverage to care. Come right to the community health center and get everything that you need. It's a one-stop shop. We're making sure we have the resources available, different types of media, whether it's social media, making sure that in our lobby we have screens playing that provide different information for folks, making sure we have pamphlets, and making sure we have points of contact in the community for other services that people may need as well. So just making sure we're the subject matter experts and can connect people one-on-one so that there's nothing more annoying than picking up the telephone and calling someone and being 8 or 9 different people in the same organization or another organization because someone just doesn't know the answer. So being a subject matter expert for us is the most important, and connecting them right where they live. I say all the time, enrollment assistants are responsible to reach people where they live, work, play, pray, and shop.
I love that. That's tweetable. And we could put hashtag coverage to care. You done gave us a whole tweet today. Yes, we love that. Thank you for taking us through that, Tia. Okay, I want to ask a question, and I think this is where we'll kind of hang our hats and then we'll open it up to our audience. So, why do you do this work, right? It's a very open-ended question, but why do you do the work? Why is it important? Where do you think enrollment assistance is headed? And if you have one, and I'm sure we have hundreds, but share an enrollment success story. I think we need to hear that it works and that it has impacted people. So, if you have one and can think of one, share one that kind of just sticks with you as you think about the success of the ACA. So I'll start with Michael. Why do you do the work?
Well, I'm a Baptist pastor, so it's ministry for us.
Yeah.
It's all part of our thing of to try to find to help the least of these. That's what it's all about. If you look at Jesus' platform, I love to tell people that we sometimes make it religious, but Jesus actually had a very political platform. And if you look at his platform, one of the things talk about that we have to be concerned about those that don't have the food to eat, healthcare, all that stuff, those things. So when in 2012, when we were going hot and heavy to promote the ACA, we were just excited to tell people about getting covered. Then once we got funding to actually become navigators, I'm like, wow, we can have our fruit salad and eat it too. Notice I didn't say cake. Our fruit salad and eat it too by being able to tell folks about it and then having funds, resources, because you can only volunteer so far because people at the end of the day have to cover their bills. The story that really sticks with me is the twin stories real quick. And you're not going to be the type of story you think you're going to have. The first year we had it, it was a couple who were, the husband retired and the wife had to keep working at Walmart so that she could keep health insurance. And they wanted to go all across the country and travel. When the ACA came out, bam, they were able to get coverage. She quit a job. They went all across the country and enjoyed their golden years. Then another one was a guy that was a company. I forget the name of the company now, in North Mississippi, and they were growing. And it was going past a couple hundred, I think over $100,000 in sales, maybe on the way to making $1 million in sales. But the wife, the husband had to work part-time so that he could have insurance. The wife was the bookkeeper. Once they got the coverage, he was able to drop the part-time job, go full-time, and that's a major company. A lot of people don't realize about the job creation aspect of the ACA, and I call the golden years prosperity aspect of the ACA, because it allows you to not have to work till you drop to retire.
Yeah, absolutely. Absolutely. And certainly thank you for telling us that, as faith believers, it is our responsibility. I often get asked why do I organize, why do the work that I do. I'm not connected to Isaiah 117. That is, I say those are my marching orders, right? Learn to do good, seek justice, help the down and out, relieve the homeless. And so that's the message version. There's certainly different versions to it, but those are marching orders. And so thank you for centering us in that and reminder and for those stories. Okay, Jennifer, why do you do the work that you do? And then, of course, share a story. We'd love to hear those.
Trying to think of a story. We serve the underserved, the community who never had the possibility to get health insurance due to sometimes just a simple language barrier. There wasn't enough people helping. I want to say about 90% of our staff is bilingual. About all of our patients are Spanish speaking. And so being able to translate and educate, what else health insurance, the importance of health insurance. And it's just a great reward to be able to help people who never knew there was help out there for them, never knew there was all these services that they could get, they just weren't aware of it, or they were afraid to kind of ask questions. And so I love doing what I do and seeing patients every day and assisting, even if it's a simple phone call, sending things out, being able to assist them and ease that worry, about having health insurance and being able to get health insurance. So I definitely love it.
Absolutely. I love that. Tia.
So I think I have the two questions wrapped in one. Why do I do what I do, and share a success story? So I come from a long line of folks who are servants in every aspect of life. My father was in the Navy for 23 years, and my mom was a registered nurse. They took care of everyone around them, including me and my 4 sisters and all of the grandkids now. I started off in high school at a co-op job that was with our local Department of Public Welfare in the Bureau of Managed Care. At that time, it was fee for service. So I sort of got a little inkling about how states had the ability to help folks who needed help. And fast forward all the way till now, before my father passed away, he was on VA benefits. So I had to learn about that. My mom's on Medicare, had to learn about that. My husband at one point was on the marketplace, had to learn about that. My son at one point was on CHIP, had to learn about that. I'm on employer-sponsored coverage, so I had to learn about that. And I said, this is the perfect arena. I'm learning all of this information, finding out about premiums and deductibles. And I've always been steeped in servanthood and outreach. And I said, that is a success story for me, marrying all of the experiences, the life experiences that I've had, and making sure that I can impact, like Dr. Mina said, the least of these, folks who are most vulnerable, folks who just don't understand the process. There is no more confusing process than health coverage and health insurance. So I took it as a personal mission to make sure that the folks who are around me, either in a small circle or statewide or even nationally, get an understanding that there's help available. And I'm going to do the hard work so you don't have to.
Tell us, and I don't think Jennifer actually shared one either, but tell us a success story of success.
Me?
Tia or
No.
Jennifer, yeah, whichever one. I don't think either of you shared a story. You want to hear a story? Make us happy.
We have a referral care program who refers patients to us who need assistance. And a lot of the times, sometimes those patients are cancer patients. So it's not a specific success story, but we're able to assist a lot with patients who have not been able or don't meet the qualifications for Medicaid, and letting them know there is solutions out there for lower cost medication. Patients come in, I need this medication, I'm paying $600 out of pocket at this time, and being able to show them and guide them like what the options are. So nothing specific, but it's always great to assist people that are in high needs at that point, and saying, hey, you know, let's try this. I'll do everything I can to kind of assist you. We'll check all our options and see which one's the best.
Love that. Thank you. And thank you, Tia, too, for I think connecting us to your why. I think it's really important. And you know, we all have roots, and your roots sound really strong. And so I really love that your parents instilled in you the spirit of servanthood. So important to the work that we do. Do you have a success story that you can share? I'm a stories guy. We believe in stories here at Young Invincibles, and so I always love to hear a good story. So do you have one?
So I remember meeting with some consumers around year 2, and they came into my office, you know, had questions, wanted to know what this was about, what was going on. And I always spend a lot of time with my patients and consumers, and sometimes it's good and sometimes it's not, but I like to sit down and really find out what's going on and what the needs are. And the wife shared that over the years, she had developed some health issues, and they were paying an exorbitant amount for health insurance because they wanted the best, because they knew there were appointments coming up and screens and medications and things like that. And she came in and she sat down and we went through all of the options. And she said, well, how much extra do I have to pay because I have X disease? And I said, it's no extra. She said, well, I don't know what you mean, because my premium is this now because I've been diagnosed with this. And I said, yep, this does not take into account any pre-existing conditions.
Wow.
And to see the burden lift off of her, to see her face, she just cried and cried and cried. And then, of course, I had to go hug her, and then we had to spend some time getting her together. But she couldn't believe. She said, I had no idea. I'm hearing all of these good things, and now I'm hearing negative things. And, you know, I've been sick for so long, and I've had to pay extra, and we're depleting our savings. And you're telling me the premium's going to be this, and it's not based on anything, just where I live and how much we make. And I said, yeah. And to me, absolute success story
Oh,
that
100%.
I was able to be in a position to give her correct information, cut through all the political stuff, give her options, and really take time to look and explore the plan with her and get her exactly what she needed and cut the cost. I think her premium was cut by about 50%
Wow.
because of the plan that she chose and the coverage that she wanted, and the fact that there was no penalties for pre-existing conditions. So that story always sticks out to me.
Yeah, absolutely. Thank you for sharing. That's such a fantastic story. I want to shift us now into some audience Q&A. I want to give us a little bit more time than I think we have allotted, because I see some engagement in the chat. If you do have a question, I'm going to encourage you to put it in the Q&A portion of your Zoom, and Mina will read those out for us, and the panelists can answer as they wish. And so I'm excited to see what the audience has to say.
Yeah, we're getting a lot of love in the chat here for you guys. I do want to flag to folks in the audience, loving all this engagement. When you're typing in the chat, make sure at the bottom when you're typing, it says to, and make sure that says everyone next to it, because some of this really great content is just coming to me, and I think everyone would benefit from seeing it. So just double check that when you're typing in there. But we do have some really good comments and questions. A couple of ones about best practices that maybe you guys can help with. One of them is about onboarding new navigators. What sorts of resources and trainings do you all find to be like the best things to help new folks come on board and learn about the job? Open to anyone.
All right, well, for us, we like to mentor that have a seasoned navigator work with a new navigator. So in addition to, and then during the training process, we have an education coordinator. So the person not feel like they're out there on their own trying to pass the exam. And then finally, we have a comprehensive workshop. We have 3 of them, and one we do before the open enrollment. We've got about a 42-page booklet with information that we've gleaned that's worked well for us. They can use as a rough and ready guide to what they have. And during our workshop, it's about a 4-hour workshop. We walk through it and fill in the questions. The whole idea is to make everybody feel comfortable. And I always remind them we all are learning this thing together. So that's what we do.
That's great. I'm stealing some of that information. The resources that I depend on really are, of course, down to the assister level, the FPL chart, resources directly from our Department of Human Services and from our state-based exchange, Penny, assister training manuals, always CMS, Young Invincibles, like at the top, latest and greatest information. Also, other resources like Kaiser, Center for Budget and Policy Priority Beyond the Basics, just those trusted partners who provide information all the time on all kinds of subjects, because we can't keep up with the thousands of emails we're getting. And we know that we can get information from Young Invincibles as condensed, making sure that we're on our monthly calls, recording those, listening to them again and again, and really just making sure that we're staying connected with subject matter experts.
For us, we do a lot of hands-on. So we do a lot of mentoring with CACs and navigators, and learning how to work the website and doing the charts and all of that. So we do a lot of day-to-day because we help with CAC or marketplace year round. We have patients coming in all the time to make changes, to update their information. And so we're able to kind of do that throughout the year when it comes to mentoring and letting them watch, learning where the resources are. And then we also do have meetings with our health centers where we have them once a month. And so we're able to kind of conversate about what we're struggling with or any changes and things like that. So having those resources available.
Awesome, thank you. Another question, which I think I've seen in here a couple of times, is working with consumers that don't necessarily get the best news. You know, you may have gone through an application with them and then it turns out it's not affordable, or, you know, for whatever reason, they're not super happy with what they're hearing. Do you all have any best practices you can share for working with consumers like that?
Well, I'm always straightforward and honest. We can look at other options. We weigh premium versus deductible versus their specific needs for medications, but always be honest and have other resources available. Community health centers, if folks say, you know, I can't afford this, but I know that, you know, I have issues or I know that I need care. Well, you know what, you've come to the right place. You may not have been able to get coverage directly from the marketplace and you don't qualify for Medicaid, but you can get the absolute best care at a community health center. And really talk to folks, because they just want to be talked to. They want to be heard, and they want to make sure that the trusted partner who they're talking to is going to be upfront and honest with them. So that's the best practice for me.
Well, I think the thing, picking up what Tia said, the federally qualified community health centers, we instill in all of our navigators to give them a continuum of options and let them know on the front end. You may find that these premiums may not be what you're able to afford. You know, if they told me it was $50 a month, I'd jump up and run around the building. But for some people, that's still too much. And so we let them know that we're going to at least connect you with a federally qualified community health center, which Mississippi is the largest network per capita anywhere in the country. So they feel at ease. They know when we're done with them, they're going to have a place to go.
We have here at One World, we have sliding fee scales. So again, we kind of have everything all in one building. So we run through a Medicaid and marketplace with our patients. And if there is absolutely nothing that they are able to afford or they're eligible for, then we do kind of have that sliding fee scale that they can fall on based on income. We have different programs like the HOPE program if they do need to see a specialist. We have patient coordinators who kind of assist with financial assistance at our local hospitals. So we have a lot of great resources all in one so they can get it all done. And we're able to kind of confidently say, hey, you know, we can help you here. Let's take you with our coworkers. They're able to kind of assist you on that next step.
For us, it's important to, and I stress this with our community health centers, with the assistants, is to have a good relationship with your local county assistance office, because they may not qualify for the specific adult basic category, but there may be other categories of Medicaid they could qualify for that have different income levels, like the MAUD program, Assistance for Workers with Disabilities. And there's all kinds of categories. So it's important for the enrollment assisters to be subject matter experts on Medicaid as well.
Absolutely. We've got a little bit of a technical question, but also a best practice question, which I think a lot of folks have had over the course of the pandemic. But how do you all go about collecting consent when you're doing over the phone and Zoom enrollments? I think it varies from state to state, but could you maybe tell us a little bit about what it looks like, at least in your situations?
So I'll jump in. We have a template for verbal consent. And the rules for our organization is that you can obtain verbal consent. And we have a retention policy for that verbal consent because it has PII on it. It's locked up. And we make sure that we're following all the rules and regulations when collecting that information. We assure them, you know, you have consent for this period of time. You can revoke it at any point. We're not selling your information. You know, it's being locked up, it's secure. And just really assuring folks that we're not going to do anything with their information, but making sure you have those policies in place.
Right, and we follow the same thing with Tia. Tia says we actually go through and talk to the consumer and read them the excerpts from the consent form, and actually we actually, if people have a problem, we can email to them. Have a problem with email, we actually take a snapshot of it and text it to them so they can review it. Need to, we can follow up, put it in the mail to them or whatever, and we get a witness. Usually what happens in it, the navigators, they work in tandem, and there's another person that is saying that they heard the person say they're giving consent to what they have. Let me just be honest with you. It's never going to be a problem with this consent or anything until there's a problem. Because let's just, because naturally when you're doing something virtually and in this environment, if somebody really wants to make a big to-do about it, they can. So I think the most important thing we can do is just make people feel comfortable and ask some questions. And I'm not saying that we're gonna have any shoppers, anybody dealing with this process, but I want everybody to be mindful of when you're going through this process to make sure you dot every I, cross every T when you're doing this. And don't fall in the trap of somebody saying that, oh, well, you just do this for me, just do that. Just follow it step by step and make sure you have all the documentation to back it up.
We do the same. We have a verbal consent we run through when we do assist virtually. And then also just give them the confidence that, hey, you are the one who can say at any point, I don't want to continue with this anymore. I want to revoke this consent, make changes on it. So always giving them that confidence that they are in charge of their personal information and they're able to do as they wish at any point. If they want to give us consent for one day, for a year, that's always something they're able to do.
Thank you all. Another question, put your health insurance literacy hats on. Once someone gets their insurance, how do they find out who's in their network? That's a networks. I'm sure you all can talk about why it's important to know your networks.
I will go.
Go ahead,
Oh.
Jennifer.
So that's something we always try to ask before we kind of go on the overview of the plans, because a lot of the consumers we see are from our clinic specifically. We always still confirm, where is your primary doctor? Where are you looking to go? Do you have any immediate major appointments coming up that we want to make sure that are included? But I've also, we do a lot of training on how to work each of the company's websites. So trying to figure out for Bright Health, looking up where that network covers in your specific local area and being able to provide that information to the patient the day of enrollment so they're aware of where they can go and where they cannot go.
Yeah, and piggyback what Jennifer's saying, also for the people that we have quite a few people who've never had a person, hadn't ever been, need to. So we talk to them once they get the coverage to go through and look at the network and see where they can go to that specialist or that provider. And of course, if they have any questions about making a connection, contact us and we can help walk them through that process.
For me, that's always an integral part of the initial conversation because people are choosy. Which hospital, if you have to go to the hospital, which hospital do you want to go to? Okay, which doctors do you want to see? What medications do you take? And I ask all of those questions up front just to make sure, because on the back end, they'll come and say, well, I had to go to the emergency room and they said it was out of network. And I always go to this hospital. Well, I start off the conversation with, where do you want to go? Because networks are extremely important. And when you have folks who are looking at their dollars and want to use them wisely, like everyone does, you don't want to be forced to go out of network. If your doctor is 10 miles away and the one that is closest to you is the one that's, on that health plan that you're thinking about choosing, you really have to weigh the options. So networks can be very tricky. Even though we are a state-based exchange, I encourage all the assisters, call the physician's office and ask, do you participate with this specific plan? And a lot of times we're finding that we as assisters are educating provider offices about the difference between Marketplace, Medicaid, Medicare, and CHIP. So it's a lot of education taking place, but really making sure you ask those questions about network up front, that's important.
Absolutely. Absolutely. very scary to go to an out-of-network provider for sure. The sisters are the trusted messengers in their communities. You have to have really sometimes difficult conversations, personal conversations with the folks that you're working with. How do you all go about, building that trust, making sure that the consumer feels comfortable giving you the information that you need to help them?
Well, for us, we've been around since 2013. So we're the Obamacare folks. That's what they call us. And so at this point, 10 years out of doing this, that's not really been an issue for us because they know we've been around. We're going to take care of them. For those maybe the newbies, we have sub-grantees that are in the faith-based community that really work with the houses of worship across the state. We do workshops and health fairs with them, and they put a blessing on us that we're the people that you can trust in getting that done. If you are new to this game, just starting out, then you need to attach to some folks who are trusted voice in the community to make sure to get those things done. So in our case, we've got the street credibility, but if you haven't got it, then you hook up with somebody who does have it.
For us, it's always about building relationships and knowing that community health centers have been around for more than 50 years. We have the stamp of approval from federal, state, and local, from houses of worship, faith-based organizations, other organizations throughout the community. So that trust is there, that longevity is there. And a lot of times in the current work environment that we're in, folks really don't like to give information over the phone. They would rather be able to drive down the street and say, okay, that building's been there for 40 years and I know the people in there. I trust them. And that's really one of the makes community health centers one of the trusted partners in the community.
Same for us. We've been here. We started off in a small office with 2 volunteers who, were here to do the work and make it happen for as many people as they could. So we are a very known name here in the community, and because we've offered all these services. And so again, a lot of it is also word of mouth, helping family members and, hey, my cousin got help here and they're great. They give me all this information and being able to build those relationships where you're able to get more people. Hey, my cousin told me to come and see you. You helped her, what are you able to do for me? And so being able to make people feel comfortable and connected with us, getting to know them, not just, okay, what are you here for? How much can you afford? But what are your actual needs? What can I do? How can I make this process easier for you? So I think a lot of that is just, talking to the patients, like it's been mentioned before, and getting to know them, just, beyond the surface level of just, where do you work at? What is your family? Just the general information.
Yeah, I definitely feel that. And like what Michael said, when I was a certified application counselor, it took time for people to get to know who I was, but eventually I was Obamacare girl in my little West Virginia town. So it might take you some time, but it does happen. Let me see. Oh, question about small businesses. In addition to community outreach, how do you reach out to small businesses to help them get insurance for their employees and their families? How do you get in with the small business community in your areas? If you do.
We don't do small business here at our clinic. Ours is more of an individual, but we do see a lot of workers who aren't offered insurance. It's a business where they don't offer anything at all, and they're kind of at a loss as to what the next step is. That's kind of where we come in and we assist with, again, walking them through the process and all of that. But we don't work with small businesses or small business insurance for companies, unfortunately.
We encourage our enrollment assisters to get to know the brokers who are in their area. So if we get inquiries from small businesses, we can refer them to some of the brokers and agents in the area who specialize in getting coverage for those folks. And just like Jennifer said, for organizations or businesses that don't offer health insurance, they know to call us.
All right. For us, we're slightly different. We are trying to get our affiliates to join the different chambers of commerce or the economic development entities, know that we're there. So what ends up happening many times, we come in and we enroll. Some of the companies don't want to get in, small business don't want to get involved with doing health insurance, and they just as well will give a subsidy or something for their employees to cover it. We do a lot with houses of worship where their leader they may want to get covered. So that's how we end up making the entree. We don't usually work with brokers because we end up in the spring having to fix up some of the stuff they messed up. So we just kind of steer clear of them. And I'm not disparaging. Not all, many moons ago, I was an insurance agent. I was scrupulous, not unscrupulous. But anyway, we just rather not do that process because we don't know what you get. It's good to be said life is like a box of chocolates. You don't know what you're going to get, but that doesn't work if we're going to refer. So we just try to take care of everything in-house. Okay.
Awesome. Thank you all. I do want to shout out to everyone in the chat. Stephen Goldman is in the house. If you don't know him, he has been doing this a long, long time and he knows his stuff. So if you're looking through, check out Stephen's comments here or there. They're very helpful, very, very helpful. You're welcome, Stephen. I think that's it for the questions. Greg, do you want to wrap us up, close us out?
Yeah, absolutely. Absolutely. Thank you, Mina, for assisting on that. And I think y'all were in y'all's element answering those questions. And so it was great to see and great to soak up all that incredible information and knowledge. This has been really the highlight of my day. I cannot stress that enough. I mean, I love the work that you all do around connecting people to healthcare. I mean, that is the very base, kind of the basis of what you all do, and it's incredible to be witness to that and to be recipient of all that you all offer across the country every single day. Fantastic conversation. I learned so much, and to me, it sounds like we are in a really good space as it relates to the way in which we experience open enrollment. And we have a lot of amazing things going for both the work and the recipients of the work that we do, the consumers. And so that's really exciting to me as someone who organizes around this on a daily basis. And certainly I'm certain that, folk in the chat and who's joined us, over 200 people from across the country has joined us, I'm sure have the same feeling of both urgency and excitement for what's ahead. So that's a wrap. That's it. Join us for our next session, which I believe is at 3:30 Eastern time. I'm not entirely sure what the session is, but if you're interested, please return after a 10-minute break and join us for that. Tia, Michael, Jennifer, thank you so much. And thank you for all the work that you all do. And we hope you all have